Hey, everybody, welcome back to the Energy MD podcast, where we help you resolve your chronic fatigue, ME/CFS, long COVID, and MCAS by getting to your real root causes, what I call the toxic five, the heavy metals, chemicals, molds, infections, and trauma. So, really excited about our interview today because we're going to be talking with Dr. Jenny, and Dr. Jenny's last name is Tufenkian. Did I say that right?
You did. Amazing. Yes.
Okay, excellent. I've been working on it. And so let's learn a little bit about Dr. Jenny. So she's an expert, does similar things to what I do. So I'm really excited about this conversation. So Dr. Tufenkian has been treating complex chronic illness for over 2 decades. Having complex chronic fatigue herself, she had no choice but to dig deep into the literature and uncover the root causes of chronic fatigue. Through her research and experience, she developed an effective system to unlock the 5 core energy drainers that we'll be learning about today, so that those who are too exhausted to function can start feeling like themselves again. She shares this system with clients and practitioners online and in person. Her unique spin and secret power is to combine a very left brain functional medicine approach along with deep subconscious work. This allows powerful shifts in both the physical and energetic bodies. She teaches widely to the public, health professionals, and corporations. She is also a mom of two, happily married, and loves her time outdoors and in the kitchen. Dr. Jenny, thanks so much for joining me today.
Thank you so much for having me, Evan. It's just a pleasure to be here.
Yeah, I've really enjoyed our conversations over the last year or so since we've known each other. So excited about picking your brain and learning from you. And learning more about what you do. So, there's a couple things that you mentioned in your bio that I'm really excited about. One is talking about the 5 core energy drainers. Can you tell us more about those?
Sure. I call them the 5 root causes that lead to chronic fatigue, ME, and even long COVID. And I think we're going to find a lot of parallels here between what you're doing and what I'm doing and what we both see in these patients that come to us who are really sick and have been sick for decades. So the first one is I look at, and I call this the gateway root cause, which is the hormone triangle. So that's looking at the adrenals, the thyroid, the ovaries or testes if you're biologically male, and looking at that system. And this is a gateway root cause because so many of us are just on the stress express in this culture, especially if we're parents and professionals and we're just pushing ourselves 24/7. It's really easy to get that stress response dysregulated early in our life. And if that continues and doesn't get addressed, then you can end up becoming vulnerable to it becoming a prolonged condition and entering into extreme chronic fatigue. It certainly was a gateway for me as a mom in medical school, for sure. The second one is looking at mitochondrial function. And the mitochondria, as I'm sure many of you listening already know, is the powerhouse within inside of your cell. And some of us have mitochondrial dysfunction, which disallows the body from having normal energy production and can lead to you having extreme fatigue. The other one is looking at toxins. So, and of course, these root causes are interrelated. So there's a toxic burden. We all have way too many toxins in our body because we've done this amazing thing called industrialization, where we've dug into the earth and pulled up these metals. We've created things that we don't even have names for of, toxic pollutants that are really hard for our body to process. And those can gum up the mitochondria and other parts of the body. The other one is chronic infections. So number 4 is chronic infections. And we all have we have what's called a virome. We have a whole host of viruses that are in us. We also have a lot of fungi in us, other critters that aren't us. And those can come out of dormancy and get activated and lead to the chronic fatigue. And this is indeed a huge piece of long COVID, as I know you're aware of. And the 5th is looking at that limbic emotional piece. And that's where the trauma that you speak of really lives inside of the nervous system connected to the brain. And this is where I find that many people, if they've experienced early trauma, most of us have some sort of trauma from our childhood or generational trauma that can become one of the setups to making it easier to fall into a chronic fatigue, long COVID type of pattern. And then the illness itself is traumatizing. It's traumatizing to have your body not work, to be able to not rely on it, to not have the social life that you need to feed your soul and your spirit. These things can make it all very challenging. And these root causes interact with each other. I find that people have one, two, three, or all five of them, depending on what was going on with them when they came into this, depending on how long they've been struggling with this condition. And really the work is to start to uncover which is the key significant root cause. What's the one that if we focus on this now, it's going to help shift the body, get back into balance.
That's a great list. And I'm really glad that you talked about how illness is traumatizing.
Yeah,
Because
right.
it's kind of like you get to this place where you don't feel well, and then you feel worse because of, your relationship to the illness. You have a certain identity and you're not able to fulfill that identity. I know when I had chronic fatigue, ME/CFS, that I saw myself in a particular way as a great father and a great husband and a great practitioner, and I couldn't do any of those things, right? So it was really demoralizing and disempowering. And then there's, of course, the medical trauma where people go and see practitioners. I know you talk about this as well. And then the practitioner invalidates them. And they're like, there's nothing wrong with you. It's all in your head.
Or they get told there's nothing you can do, which is the other thing that really I feel angry about when I hear that, because I don't believe that. That's not what I see, and that hasn't been my experience. And I think that's a very powerful message to put in someone's head. And often we need to work on that when we're talking with people about there are ways that your body can heal and heal. But yeah, and I'd say, speaking to that trauma of having chronic fatigue, ME, long COVID, I know that my experience through having it, as a mom, I found it hard to see my family's concern in their face when they were looking at me. And I became aware of how much they were watching me to see, oh, is mom okay? Is she okay now? Is she not okay? And sort of this hypervigilance. I began to feel bad about the hypervigilance they had to have around me, It
Mhm.
became this layered thing that I needed to work through. And then when I was in periods of incredible health, it's like I had to retrain them to go like, I'm fine. Like I can actually climb this rock and I'm good. You don't need to worry about me.
Yeah, that's an important point. And it's, oftentimes when we talk about trauma, a lot of people think about really significant abuse,
Yes, right.
but it can be, anything that really changes the way that we look at the world and, our relationship to our parents, right? We're supposed to, like, part of our relationship with our parents growing up, we're programmed to survive, right? And so we want to do everything that we can in order to make sure that that relationship is intact. So the concern that your kids had for you was, part of that assurance to make sure that the parental figure, right? But then this ends up contributing to limbic system dysfunction and stuff like
Right.
that. Can you talk a little bit more about that sort of thing and some like family dynamics and how that can contribute to these issues?
Sure. Limbic dysfunction is really looking at how the limbic brain, which is part of the emotional center, it's a number of different sections of the brain combined together that creates the limbic brain, and it connects with the vagus nerve, which is the longest nerve in the body. That vagus nerve is always feeding information from the organs, from the tissues, from your body up into your brain. And basically, the limbic's brain job it's helping you assess, are you safe? Is it safe right now, or is it dangerous? Is it safe? Is it dangerous? Is it safe? Is it dangerous? And we all have filters from our past experiences. We have filters from our childhood experiences. We have filters that comes through our genetic line. We have filters in our energy bodies that can make that filter go over that limbic brain so that we may be more biased towards seeing things as not being safe, or more biased towards things feeling pretty darn good, and feeling like we're safe. I have a practitioner who does a friend who does reflexology, and he says sometimes I get princess feet. That's somebody that comes in and their feet really don't have any hard places because their life has been that of a princess, and they haven't had a lot of life's challenges. Those are not the people I see. I see the people that have had a lot of challenges, right? And their brain tends to be more filtered towards seeing things as being more dangerous. How that connects to childhood trauma is, of course, if you have experienced anything as being traumatic, and these could be very traumatic events, of course, but they can also be what we call small T's that turn into big T's, little traumas that are big because of the stage of development you were in as a child, or
Mm.
because you weren't allowed to process that your goldfish died in an appropriate way because mom and dad were out of town that weekend and the nanny was taking care of you, and you didn't have a chance to really feel held and safe and cry when your goldfish died. Doesn't have to be a big thing, it can be a little thing. And that begins to make you feel like you're not safe in the world. And you start to interpret that with your limbic brain. What happens, the limbic brain is also seriously impacted by things like toxins in the body or viruses or any kind of inflammation, because it picks up the information. Say you have dysbiosis in your gastrointestinal system, you have irritable bowel syndrome or SIBO, small intestinal bacterial overgrowth. Your nerves are literally picking up that information and bringing it up through the vagus nerve, sending it to the brain and saying, we're not safe, we're not safe. You amplify that with, I wasn't safe when I was 4 years old. You amplify that with some inflammation from a chronic infection that hasn't been handled. And the limbic brain begins to make you, begins to say, okay, you're in a very dangerous place. We need to start making you safe. And the way that it makes you safe is it sends out even more signals of pain, of fatigue, of depression, all the things that make you want to go and hide under a rock in your cave so that you can stay safe. It's basically saying it is way too dangerous out there. You need to hide. And it throws out a lot of signals to the brain and the body, and it becomes a vicious cycle. As the limbic brain is sending those signals out, your hormones are getting altered, your neurotransmitters are getting altered, your immune system is getting altered, and it makes it much harder for the body to return to that place of homeostasis and balance that we need to stay to heal. From a nervous system perspective, you are stuck in a stress response, in a sympathetic stress response mode, and you are continually in fight or flight. And it's really the limbic brain is trying to protect you and tell you to stay safe and to stay hidden.
Yeah, that's a wonderful explanation. It's doing its best. It's kind
It
of like our
is.
parents,
It
right?
is.
They did the best with what they
Exactly.
got. And so
Exactly.
it's trying to
Yeah.
serve you, it's trying to protect you, it's trying to
Yeah.
take care of you.
Yeah.
And the reality is that it's screaming at you saying, "Hey, I don't think you're listening to me because there's things going on right now," right? And so there's all this inflammation
Yeah.
and all this pain and
Yeah.
dysfunction.
Yeah.
That was really
Yeah.
great. Thank
Yeah.
you.
Yeah.
And
Often. Yeah. Often one thing that I've always thought about when you're thinking about the limbic brain is it's like there's like that inner 3-year-old in there. Like that subconscious mind is like that 3-year-old that's like just trying, it's kind of having a tantrum,
mhm.
it's trying its best. It's just not very sophisticated.
So what I see with limbic system issues in trauma is that sometimes it's 10% of the problem for folks, and sometimes it's 90%.
Yeah.
What are you seeing?
Totally. I love that. Yes, exactly. And that's why I don't say everybody has all of these root causes. And that's why you have to be selective in terms or, astute for yourself. Those of you that are listening can be hearing this and think, okay, which ones are the triggers for me, the big root causes for me and us as clinicians? I believe it's when we're taking that history with that person that we can really begin to be listening for different things to help us decide, is the limbic really huge for this person or not? I've had people come in where I'm like, hey, your first stop is limbic dysfunction. I had a patient come into me decades ago, and she had a whole host. She had SIBO, she had fibromyalgia, chronic fatigue, she had had a motor vehicle accident, she was in chronic stress, chronic pain, she had small intestinal bacterial overgrowth, she had a ton of food sensitivities, she had a whole host of things, and I knew I could have sent her out for thousands of dollars of testing to confirm all of these things I thought she had, but I could tell that she was severely dysregulated in her limbic brain. And I said, I honestly think your first stop is to focus on the limbic, and then we will work on whatever is left. And the things that I listen for when I'm trying to figure out if their limbic brain is primary are a couple of things. One, multiple chemical sensitivity. Multiple chemical sensitivity to me is a sign that the limbic brain is dysfunctioning. And some of you listening may be like, no way, that's crazy. Like my multiple chemical sensitivity is me. I'm a canary in the coal mine. I know the world's toxic. I'm just more sensitive. The rest of you are crazy. And I get it because that's how I felt about myself. I'm like, yeah, like, your bounce, fabric softener makes me feel horrendously ill, as it does many of my patients. The strangest thing, though, when I did limbic healing for myself and I experienced the night and day experience, once my limbic brain came into balance, was I'm in the bathroom with the soap in the airport and I'm going, oh, it's kind of that honeysuckle smell of that perfume grandmother gave me when I was 8 years old. And all of a sudden I'm going like, whoa, I can smell the soap like they thought it was supposed to smell. It doesn't smell like a toxic chemical that's trying to kill me anymore. And this is one of the things that I honestly use in myself now. I can tell if my limbic brain is out of whack just by my sense of smell. If I'm reacting to chemicals, then I know that it's time for me to do some limbic exercises to get myself back in alignment. So that's one thing. The other thing that I'm listening for is it's what is the lens that they are explaining everything through, right? And there's a very there is a survival fear state that comes on when you're in limbic dysfunction, when that is dominant. And that comes through in how you're describing your symptoms. Everything is too overwhelming. Everything is too much always. There's never a break. There's never it's that Danish film storm scene over and over and over again. There's never the break in the storm where the sun comes out and you get to dance around in the meadow. It's always hard. That's a very classic limbic brain state. So those are some of the things that I'm looking for. But I totally agree. It's not everyone has it completely. Yeah.
Hmm. And you talked about multiple chemical sensitivity,
Mhm.
which is now kind of called mast cell activation syndrome. Can you talk a little bit about the difference between those two? Because I kind of see them as one and the same. I think that and
Yeah.
mast cell activation syndrome is like it can be multiple different parts of the immune system. It doesn't have to just be mast cells and histamine, that are
Yeah.
overreacting. Or what are your
Yeah.
thoughts on those?
Yeah, that's interesting because I don't see those two things as the same. I
Okay.
see mast cell activation syndrome as your mast cells getting overactivated as the immune system being hyper responsive. I would also say that I think that there is a overreaction in many people, if not all, people with chronic fatigue, long COVID, myalgic encephalitis. There is a hyperinflammation, chronic low-grade inflammation throughout the body, particularly in the brain. And that's where we're seeing a lot of mast cell activation happening in the brain. And those people may have completely normal IgE levels, not high or even high histamine levels, but that is the process that's happening in the brain. So yeah, I don't see, because of my experience with limbic healing and multiple and MCAS, I don't see those as being identical situations. Yeah.
So then how does MCAS differ from um, multiple chemical sensitivity?
I think that MCAS is, well, I guess I'll back up and say that when you heal the limbic brain, what we see is that the immune system does be able to go into a state of normalizing. So in that sense, I could say, okay, if you treat the limbic brain, your MCAS is going to go away, which I see over and over and over again. And I think really it's just a different lens where I'm not worried about an MCAS diagnosis. And that's just me personally. I see a lot of people with MCAS, but that feels like secondary to all the other things that are going on. I know people come in with that primary diagnosis, but to me, as a clinician, in terms of what I'm listening for in them and what I'm going to suggest they do so that they can get help, isn't different than if they come in with chronic fatigue, ME, or long COVID, because I'm still looking for the same root causes. And if their limbic brain is in dysfunction, then I'm going to see that their immune system can normalize and their overreactive system will change. Now, that said, somebody with MCAS, I'm more likely to, when we're talking about the food component, about and the diet and the gut, I'm more likely to recommend, we're going to go for a low histamine diet to get that histamine load down. We're going to go towards supplementation that works on that high level of histamine response, overreactivity, so that kind of thing. But I think for me, it's just not a, and this is just, this is just pure, clinician, how do you divide up? How do you label what it is that you're working with? But so yeah, it's kind of a non-answer, isn't it?
No, it's good. I mean, I see it as a spectrum. So it's kind of like when people are more reactive,
Uh-huh.
what's
Yeah.
happening, right? The immune
Yeah.
system
Yeah.
is hyperreactive. There's more of a
Yeah.
burden, and so for me, like whether it's multiple chemical sensitivity, which, we can't really diagnose, and even the diagnosis
Right.
for MCAS is not very good, so it's kind
Yeah.
of like what is actually happening? It's like these people are more reactive to stuff.
Yeah. Right. Yeah. Yeah. Yeah, exactly. And but I guess what I would say is that I think that that's happening on some level with everyone with chronic fatigue, long COVID, myalgic encephalitis. They're
Right.
all having this. They all are. So what level is it and what are they reacting to? That's the question. And what's the most effective pathway for them to get in and to be able to calm that system down? So again, for some people, it's a limbic brain. For others, it's going to be diet. For some, it's going to be both. And there may be multiple other things. Including some of the other root causes that would make the most sense to get that out of there. I mean, you get the mold out, right? If you get that toxic load out of the mycotoxins out of the body, then a lot of that MCAS goes away because that's the root cause. It's not that, I think that's the thing that I trip up about with MCAS as a diagnosis, because outside of doing green allopathy, where you're just suppressing the overreactive histamine system, you're not really fixing the problem.
Right.
And so I think that's honestly where I'm coming from and why I'm kind of blah, blah, blah around it, because that doesn't feel, it's like, okay, fine, you have MCAS, great. That's going to help put a filter on in terms of us looking at lowering your histamine levels while we are looking at the root cause. What is the root cause for you? Which health foundations do you need to address to actually heal this thing so your body stops doing this? So.
Amen. Yeah. I mean, you call it green allopathy. I call it natural band-aids, so it's kind of
Right.
like this idea of, yes, we've got a natural thing that we can use that's like
Yeah,
an
right.
antihistamine, but the
Right.
reality is that
Yeah.
it's just a band-aid and we need
Yeah.
to make sure that we're getting at the root causes.
Exactly. And bless those green band-aids, right? Bless them
Right.
because they can be fantastic bridges, fantastic bridges and better bridges to get you across the, choppy waters so that you can actually get to your root causes and get into the promised land. So,
Yeah, and there's nothing like getting a quick win too,
right.
to be like,
Totally.
because getting rid of these toxins takes at least a year,
Right.
from what I've
Yeah.
seen. And so it's like, yes, we want some of these band-aids in order to support people initially while we're working on all these things. The other thing you said that I really love is that the underlying root causes are all the same, whether it's MCAS, whether it's fatigue, chronic fatigue, ME/CFS,
Yeah.
long COVID, like they have all these same causes. And so can you go a little bit deeper into that?
Sure. Yeah. So which root cause do you want me to jump into? There's so many.
Well, yeah, I
We could
know,
be here
right?
all day.
Well, let's actually define some of these things initially, because we're using a lot of these abbreviations and hopefully people are on the same page. But what is really the difference between like fatigue, chronic fatigue, ME/CFS,
Mhm,
and long
mhm,
COVID?
mhm. Yeah. Yeah, there's so many different words. It's just a problem that we've had with this condition for forever in terms of it never had a great name. And the nomenclature, the naming of this syndrome has been argued over and still is to this day. So chronic fatigue syndrome is the name that we've used in this country for decades. Myalgic encephalitis is the term that's been used in most of the rest of the world. There's a big, big move and effort for physicians and people to start using myalgic encephalitis in this country instead. So we slap them together, CFSME, and try to, as we're trying to, evolve this changing of nomenclature for this term. I see them as the same, chronic fatigue syndrome and myalgic encephalitis. I think myalgic encephalitis is a better explanation of what it is. It also sounds a lot worse, and it sounds like maybe your neighbors would bring you lasagna. Hopefully it's gluten-free lasagna. If you said, I just got diagnosed with myalgic encephalitis, like, oh, I'm so sorry. Can I bring you lasagna? It's like when you say, I have chronic fatigue syndrome, like, oh, yeah, I'm tired too. And you're like,
Uh-huh.
no, you don't get it. You don't get it. Like, it's not tired. I talk about people who have myalgic encephalitis, chronic fatigue, long COVID, that they can talk about tired like a sommelier talks about wine. It's like there's all these different kinds of tired.
Uh-huh.
I see long COVID as a type of myalgic encephalitis. I think COVID triggers myalgic encephalitis in people. That said, I think that having had both, I got long COVID as well as having chronic fatigue. Long COVID has a little bit of its own twist to it in the sense that the COVID virus is very sneaky. It feels a little bit more like Lyme in terms of it shape shifts quickly. It doesn't literally shift into other forms like Lyme does, but how it responds in the body, it's a lot trickier. It's not as straightforward in terms of how it responds, the symptoms that you get from it, how it responds to treatment, different things. It's just a little bit sneakier. And I think that as we know, it affects people in different ways. So we're seeing different patterns of people with long COVID that we can put into different kinds of groups. I know that the kind that I had really has affected my nervous system. It felt like something was on my vagus nerve and just like rattling it, like this electric charge in my vagus nerve. And thank goodness I knew about the limbic brain before I got it so that I could keep telling myself that I'm safe, even though every single signal was going up and saying, no, you're not safe. There's nothing safe about this at all. Feel completely jacked up by this virus infecting your nervous system. So long story short, I see them as all being, chronic fatigue syndrome, myalgic encephalitis, all different versions of the same thing. Now, people who are just tired, I see burnout as being a gateway into this myalgic encephalitis pattern. And I see fibromyalgia as being a continuation and a slightly different expression of myalgic encephalitis, where you get more of it in the musculoskeletal system, and that's where it's expressed. But I really still see all of these as being the same in terms of you need to look at which of these 5 root causes are really key for you. And you also need to get your health foundations in order for your body to actually be able to heal and respond to any treatment that you're doing.
Yeah, I think people get caught up with what their diagnosis is, and they forget that it's just kind of a combination of your history and your symptoms and your labs, and somebody trying to kind of like fit you into a box. And so I love this focus that you're talking about the causes, is that you really can't go wrong if you're looking at your causes. Whether you have like a human resources problem at work or whether you have a problem with your car, if you actually figure out the causes, and there's always more than one with all these people that we're dealing with, then you're going to be more successful.
Yeah, that's great. I love you use the car analogy. We had our mechanic, Harold, was our favorite mechanic for generations. Like I went there when I was 8. He was my dad's mechanic, and then he was our mechanic. And I first, when I took my car to him, and I was first in naturopathic school, and I was learning how to do good histories and chart notes. And I saw his report came back from my car. And I'm like, this is exactly what I do with patients. This is the same thing. You have like all the things you ruled in and ruled out. You have all the things you're still thinking about that we need to think about and kind of keep in mind for maybe next time. And I was like, this is such a complete chart note. You could tell he felt really appreciated that he was seen, for the completeness of his work. But it's the same thing. You need to keep all of those root causes in mind. and be
Yeah.
ready for the next thing, you know?
Yeah.
Yeah.
I had a mechanic who said the same thing to me, except he said, except you get feedback. You're talking to a person and they can actually tell you what's wrong. He said, I am much smarter. I actually have to, figure this out without the feedback, So he was telling me about how his job was harder and he was smarter than me. Yeah.
Love it.
Yeah. So, in terms of long COVID, why do some people get long COVID and some people get COVID and it doesn't proceed to long COVID?
Yeah, such a good question, right? Yeah, I mean, I wish we knew that for sure and had a super simple way of assessing that and a way of shifting that, before it happened. So those of us who were at risk for getting long COVID wouldn't get it. But that said, what I know from my work and from my experience is that I I think there are multiple things that go on. I do think that I have a this hasn't been confirmed or proven, but I actually do think that for some people who have a tendency towards myalgic encephalitis, there may be a genetic thing in the mitochondria that alters mitochondrial function on some deep level that we haven't quite discovered yet. That said, I know genes can be turned on or turned off, so I don't think that that means that that's your fate for the rest of your life, but I think it's easier to have a tendency for that. We see so many family clusters with similar patterns of syndromes that I think it points to something being genetic for some people with myalgic encephalitis. So maybe some of those people who got long COVID had that genetic piece in their history, and it got turned on under the situation of COVID. That said, I really think it's about if you have some of the setup for some of the root causes already there, and you have some of the health foundations out of whack. Health foundations being things like your sleep and your rhythm of your day, your movement and your ability to breathe, your digestion and detoxification pathways, your mindset and spirit. How are your foundations for health? How's your connection with yourself, your higher self? We're a physical body, we're a mental emotional body, and we're an energetic body. How healthy are those? Are they in balance? Do you know how to get back in balance when you're out of balance? All of those things massively impact our vulnerability to being well or being sick. And if you get a really wicked virus like COVID during that time, during a time when you are out of balance or you have one of your health foundations that is seriously eroded, you're going to be more susceptible to it taking root and staying in your body for a longer period of time. It's likely I had COVID twice. It's likely I had it in February of 2020 before we knew, well, some of us knew I knew it was coming. And it was ironic because I was on a flight going home and I was so sick I almost blacked out. And I thought, this is ironic because if I pass out in the plane, they take me to a hospital, they will not test me for COVID because I've not been to Italy or China. And I knew that it was possible that I had it. And I was very sick, but it didn't, and I was sick for about a month afterwards, but I was in a very strong state mentally, physically, emotionally, energetically, and I just knew that my body just needed a little extra time to heal, did the deep work on the deep cough, and I truly came out of it 100%. The second time I got COVID, I had personally had a low-grade gut infection that I hadn't treated. And I also had an immense amount of emotional stress, like crazy levels of stress. And I knew the stress was affecting me. And those two things were really huge triggers. And so that when I got COVID, I didn't have it in me to complete the process of fighting off that virus. And it went straight into my mitochondria on day 9. I could feel it overnight. Overnight, I went from feeling pretty good to just didn't have the energy to go down the stairs, didn't have energy to chew food again. It was crazy to go from high energy to low energy in such a short period of time. Because the other times I'd crashed from chronic fatigue, it had been more of that gradual sort of decline. And this was just bam overnight. So I think that it's really what is your root health when you get an infection. And people can get chronic fatigue from any virus, from any infection, and from any toxic exposure. So it doesn't have to be just COVID. It can be from anything. And how vulnerable are you in that minute when you get it? And what resources do you have to bring to it when you're sick? So,
Yeah, I think that last part was really mic drop, that any one of these things, any one of these toxins, infections, etc., can be that trigger
yeah.
that causes that. And so, you've talked a number of times around kind of like the health foundations. Can
Mhm.
you repeat those? Like, what are those health
Yeah. Yeah.
foundations, and then what
Yeah.
practices can
Mhm.
people do to optimize those?
Yeah. So these are so key for all of us. And I really think this is the thing, if there's something that I could stand up and just preach over and over and over again to everyone so that we could avoid so much illness, it would be just making these health foundations a priority, from everything from helping you heal from common colds and flus to avoiding getting chronic disease, to healing chronic disease, to avoid getting dementia, to helping your dementia improve. It's these health foundations. So really, like, this is powerful medicine, powerful, powerful. We tend to ignore it because seems so kind of unsexy, it's like whatever, you know. And they are, I'd say, the first is sleep, getting your rhythm. I put rhythm and sleep together because we really run best on a circadian rhythm pattern. There's so much that happens with our inflammation in our body, with our immune system, with our hormones, with everything in our body if we're on a more regular schedule. So getting up at about the same time every day, going to bed at about the same time every day, eating at about the same time every day, and moving at about the same time every day. Really setting that schedule for yourself can be very, very helpful. And then making sure that you are getting adequate sleep. Less than 7 hours of sleep triggers inflammation. So if that's you, then really focusing in on getting that sleep. While you sleep, you heal your body. As an adult, that's what we're doing at nighttime, as we're healing. So super important. The other one is digestion detoxification. So as naturopath functional medicine doctors, we are full in on this. Gut is so important. So making sure that you're eating the foods that are good for your body at this moment in time. There's no perfect diet for everyone. It's where your body is right now and what it needs for what you're healing. That's what you need to focus on, eating those foods, and not and just focus and realizing how important your health is and making that a priority. And your ability to detoxify is super important. The next is looking at your movement and breath. So some people who are really down with chronic fatigue, long COVID, chronic fatigue, myalgic encephalitis, can't can't exercise, yet there are ways that you can do movement. You can imagine it in your head, and you'll get 30% of the benefit as if you actually exercise. And this can be powerful for you to just start setting that into your schedule. You can also do breath work, and that helps move the toxins out of your body. It helps to move the lymph, and you get the benefit of the detoxification aspects of exercise when you do this. Just simple yin yoga, walking can be fantastic for people who are able to do that. So really finding the movement that works for you wherever you are in your health journey is really important for getting the inflammation down, for helping your brain health, for normalizing your body. And then breath just comes along naturally with that. We need to be breathing to trigger that autonomic nervous system to know that we're safe. Short upper chest breathing is a stress response. Deep diaphragmatic breathing puts your body into that parasympathetic state. So that's something that we can consciously begin to shift so that we can relax our nervous system. It sends the message to the brain that we're safe. So that can be a really easy way that you can just begin to feel more safe in your body and to heal, is to just use your breath. And then mindset and spirit is the fourth foundation, where you're really looking at what are those tapes that you're playing in your mind all the time. Is it like, oh God, I didn't do good enough, I'm so bad, blah, 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 the negative stuff? Or is it positive? What's that subconscious message that you're sending to your cells? We know from research now that the emotions we feel, the things that we're saying, have an energy imprint that impact each one of our cells, and that energy imprint impacts the DNA. It impacts what proteins are created, and that directs how your body can heal. So it's really important to work on healing that inner messenger that you have inside of you, learning how to love yourself so that you can be saying beautiful things to yourself most of the time. We all have negative thoughts. It's part of the brain it's part of the brain that keeps us alive. yet, working so that the balance is something where you can come to a place of positivity is really helpful. And then there's a fifth one that I brought in since the pandemic, which is connection. And connection really seeps through all of them. And that's connection with yourself, connection with your others. We are so community oriented and we feel starved if we're not connecting with community. So how are you connecting enough with others? And then connecting with your higher self, whatever that means for you. So it's really that, expanding out to that bigger energy field and being connected in that way. So I really see that permeates all of those. So looking at each one of those, and what I suggest for people is I know I went through those quickly and it was a lot of information, but just really imagine that being a foundation for your house and think about, which ones are really strong and which ones are a little bit weak and need shoring up. And you can choose one to work on, just one, just choose one to start with and work on that. And you can either choose the one that's the weakest because it needs the most help. So your digestion's a mess and you really just want to work on that. Then focus on that. And that's going to be huge. It's going to have massive impact on everything else. Then you can work on the next one. Or you can choose to work on the one that's not so bad. Say that you've had horrendous sleep your whole life. You never slept well. Maybe you don't want to start there. Maybe you want to start somewhere else because you know that that's a deeper issue. Work somewhere else so you can start seeing that positive gain. And then as you start working on that, then you can begin to work on that one that's the most challenging. So that's my best advice for people, to work on those. But it's one of those that you just keep looping through and can keep improving. And truly, I know a lot of you listening are really struggling with your health and you want to work on these to get your health to the next level. It will literally help anything, any treatment that you're doing will work better. And I also want to tell you that this is exactly what elite athletes do. They focus on these health foundations and they have teams of people helping them do this. So this is not a sick person activity. This is a healthy person activity that we can keep looking at over and over again. Okay, how can I boost this up? How can I even do better than this on the next level? So that's yeah.
Brilliant. And one of the things, there might be people listening who are like, I've done all this stuff. I did a limbic retraining program for years and I'm eating right and all this sort of stuff. And that just means that they haven't addressed some of the other causes, right? The toxins that are present.
Exactly.
Mhm.
Exactly. And I get it, man. I get it. This is hard. Sometimes there are those points where like, oh, geez, I've been doing this for so long. I've been doing everything right. Like, it's
Mhm.
like, just like, what is up? I get it. I've been there myself. I have those moments too. Yet I also say that it's just good to feel those feelings, honor your feelings when you're feeling frustrated, pissed off, angry, scared, all that stuff, and move through it. It's like feel it and then be able to release it and move through. And there's always something else out there for you. It's really just keeping that curiosity and that hope alive to keep knocking on those doors. You will find your root causes. You will figure out your health foundations. There's something else in there for you. And the other thing that I really believe in has been my experience, and when I work with people, I see this over and over and over again. There's always a gift in here. And I know it doesn't always feel like it at times, but there's always a gift. There's something in there where you're going to come out stronger, more knowledgeable, know yourself better. There's going to be something that's going to open up for you through this process of healing. And that's always exciting. I love watching it when people just hit that transformation level where they're just like, oh my gosh, I had no idea that I needed to do, there's like, that there's all this art in me that I needed to do, or there's this new relationship I get to have, or this new career, or something comes out of this time of healing.
Yeah, I think that's such an important point. Um, the challenges that we have really it can be a spiritual journey,
100%.
if you let it be.
100%. Yeah. And honestly, I think that's if when you can embrace it that way, it makes it an easier journey, because it makes sense. Yeah.
Absolutely. And the
Yeah.
other thing that I think I'll add on is that, if you've done like a limbic system retraining program or you've like, I have this connection, I'm working on my mindset, I'm not getting where I want to go. It's going to be, if you continue to do that work, like Dr. Jenny said, and then you start to address these other toxins, the effect that you're going to get, in 3 months, in 6 months, in 9 months, if you
Mhm,
continue to do that work, or even if you pause for a little bit and then you come back to
mhm.
working on your limbic system, all of a sudden it takes in a different way
Yes.
when you're at a different place.
Yes, exactly. I think just the same way that we talk about people get into dis-health and dis-ease, and it can feel like, oh, my life was fine, I was doing fine. Then all of a sudden, boom, I'm down here feeling like I can hardly get up in the morning. I can't function. It's like I feel like I'm 95 and I'm only 30. That you feel like it happens all of a sudden, but when you go back, you realize that there was this one thing and this one thing. You're eating this food that wasn't good for you, or you were doing this thing, you were doing this thing. It's the power of ones. They start adding up and they all of a sudden tilted the scale. It was just that last little thing that tilted the scale and pushed you down. It's the same thing when you're healing. It can feel like, oh God, I'm working so hard. I'm putting this diet in. I'm working on my sleep. I'm doing this. I'm doing this. And it doesn't feel like you're having that huge breakthrough moment yet. But it is, again, it's the power of ones going up the scale as well. And then all of a sudden, there can be that point when all of these things kind of meld together and your physiology just shifts. It shifts into a different state. Would you
Mhm.
agree with that? Is that your experience as well?
I would. And, I find that in our programs, like the magic happens around month 6, month
Yeah.
9,
Yeah.
depending on how many causes somebody has, the severity of
Exactly.
those causes, and whether they're doing
Yeah.
the mindset and the trauma work.
Yeah.
Is
Yeah.
that what you're seeing as well?
Yeah, yeah, it really depends. I bring people into work for 6 months or 12 months at a time, just really focused. And some people need more than that. And some people at 6 months are doing amazingly well. They're the people that have not been as sick as long, don't have as many root causes, or there was just some things that, frankly, were just missed by other physicians that aren't that challenging to treat, like just, reactivated Epstein-Barr virus, something like that, where it's just they just needed one or two things to really work on, and they were able to shift out. People that have been sick for longer or have more of the root causes and health foundations that need addressing, it takes more time. If you have a gut that with severe dysbiosis, it just takes time for those cells to heal. Like you said, if you have a heavy burden of toxins, it's not just one round, it's going to be multiple rounds of needing to pull the metals out or to work on the mycotoxins or to move out of the house or to get it out of the car or whatever, I mean, it's a process.
Right.
And when you're dealing with four of those or five of those, it just takes time, because the body can only do so much at a time. And I really think it's just, oh man, I just want to say, hang in there, people, hang in there and keep going. You're doing great work. That's what
Right.
I want to say, just hang in there and keep getting the support you need so that you can get to the next level. Yeah.
Yeah, and I think that reframing oftentimes really helps. People are
Yes.
sometimes thinking, I've been sick for so long. You're telling me this is going to take at least 12 months and probably longer.
Yeah.
But if you think about it as like getting a master's degree in your health,
Yeah.
like if you went to college, if you went to high school, like there was a return on the investment of time, energy, and money that you spent in there, right? You got something out of it. And the same thing goes here for when you make that commitment and you're working through all of your causes, that at the end of a year or two, you're going to be a very different person, and that changes the trajectory of the rest of your life.
Yeah, absolutely. I mean, I think those people who have had chronic fatigue for decades would say, oh, a year or two, no problem. I know I started working with somebody and her comment to me was like, oh, I wish I'd met you 17 years ago. I wish I knew this 17 years ago. And I'm like, yeah, I wish I knew everything I knew now when I first had chronic fatigue too, because it would have been a 6-month process instead of a 2-year process to get out of it. But that said, but yeah, I totally agree. And one of the things that I always tell people is that once you have long COVID, chronic fatigue, ME, your body knows that pattern and you are at risk for reactivation. That's just a reality that our goal is to put everything in remission and to get your body healthier, but you are at risk for reactivation. One of my goals is that people leave working with me more empowered. I want you to be empowered to take care of yourself. And I'm sure, Evan, you're doing the exact same thing. It's like you want people to understand what is going on with them so that they can help themselves in now and in the future. I want people to know what their root causes are, so that when they start sensing that they're at risk for those getting reactivated, they already have the toolkit. They know which therapies work for them. For instance, when I had Epstein-Barr virus and I realized what I needed to treat it, my dad was dying and I was midwifing his death, and it was a very beautiful process. Yet I remember opening up my cupboard, my supplement cupboard, and going, oh, this is a stress. Like, as soon as he dies, I'm going to be so grief-filled that it would be a perfect opportunity for that Epstein-Barr virus to flourish. So I
Hmm.
started grabbing my L-lysine, my olive leaf extract, my monolaurin, and started dosing myself at a higher level during that period of time. And I know I saved myself from a relapse. And that's what I want for people, other people, is to understand how it is that they got into the situation, what it is that you need to get out of it, and how to stay out. Like I'm saying, like sometimes my limbic brain goes off. How do I know? I walk into the bathroom at, Trader Joe's, and the soap makes my brain freak out. And I'm like, oh, okay, I better do some limbic exercises and get myself, like, the stress is getting to me, right? And so that's how I see it.
Hmm. So we've got a couple minutes left. I've got a couple last questions for you.
Okay.
So we keep referring to kind of the limbic system
Hmm.
practices that
Hmm.
that you do. Do you
Hmm.
have a certain program that you follow? Do you have a recommendation for programs? How do you incorporate that into your life, and what do you tell others?
Yeah, it's a good question. I think there are a number of really great programs out there. I think there are multiple ways into the limbic brain. I personally have been exploring with different ways and more efficient ways that I can share it with people. So that's been sort of a personal project I've had. I do a lot of subconscious work with people one-on-one, where we do deep subconscious work with parts work or inner child or that kind of thing. And I find that that begins to address some of it. Yet that day in and day out practice is different. And I think Annie Hopper's program, DNRS, is great for some people. I think Dr. Gupta's program is really wonderful. Some people really like the Primal program, and I think they're all great programs. I know Annie Hopper's very well. That's the one I did. I did it in person with her. And I know Ashtok personally, and he's wonderful, and I think his program is great. They have very different personalities, and they have different styles in terms of how they approach. And so I usually have clients and patients say, look at them both. I mean, how do you resonate with that person? Does their voice drive you crazy? Do you feel like, Dr. Gupta's is a little bit more meditative, and Annie's is more of a neuro-linguistic programming style? I mean, they're just a slightly different angles at it. Primal, I don't know that much about, but I have some clients that have come in finding it helpful. I also think that there are ways that you can, for those people that are, you're saying some people are 10% limbic and others are 90% limbic. I think those people that are below the 50% mark limbic, I think there are practices that you can do that can really help reset that nervous system and limbic brain thing, such as doing heart math. Coherence breathing is so powerful. I've noticed a difference with my HRV levels just doing that on a daily level. And that's really getting to that. So if you don't have severe limbic dysfunction and you don't have severe trauma and things that you need healing on, just doing the coherence breathing can be huge in terms of helping re-regulate that heart brain coherence, and that has its impact on the limbic brain. So there are many paths up, to that limbic health mountain, for sure. And it's finding the one that resonates with you.
Dr. Jenny, this has been amazing. Thank you so much for spending the time with me today. Where can people go to learn more about you?
drjennytufenkian.com is my website. That's a great place to go in and find out more about what I offer and what I'm about. And yeah.
And then you also have a free quiz, tired type quiz.
Yes, tired type quiz. What is your tired type? You can check it out at tiredtypequiz.com, or it's on my website on the homepage, drjennytufenkian.com. I use the same algorithm I use to help people figure out what their root causes are in that quiz.
Excellent. And we'll put those links in the show notes.
Perfect. Thank you.
Jenny, thanks so much for joining me today.
Thank you, Evan. It's been an absolute pleasure. Thank you.
So if you have chronic fatigue, long COVID, or mast cell activation syndrome, and you're looking for help, check us out at energymdmethod.com. We have a program for almost every single budget, and we're here to help. I hope you learned something on today's podcast. If you did, please share it with your friends and family and leave us a 5-star review on iTunes. It's really helpful for getting this information out to more people who desperately need it. Sharing all the experts I know and love and the powerful tips I have is one of my absolute favorite things to do. Thanks for being part of my community. Just a reminder, this podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. It is provided with the understanding that it does not constitute medical or other professional advice or services. Thanks for listening and have an amazing day.